You're healthy and ready for kidney transplant surgery, right? Not so fast. In this video, we'll be uncovering 5 unexpected different reasons why you could be denied a transplant outright, and why these reasons are important. From things that are out of your control to lifestyle choices that you can start to change today, being aware of what's needed for surgery could help you get a transplant faster. And later on in the video, we'll also be revealing how you can get your hands on 2 exclusive free gifts, so make sure you stay tuned for that. First up, at number 5, we have active infections. It's crucial that you're in good health before receiving a transplant, and so the first thing you will get when being evaluated for surgery is a full health check. If you have a transplant, you'll have to take a lot of immunosuppressive medication afterwards to prevent organ rejection. This medication can lower your immune defenses, so ideally you should be free from active infections, as they could get a whole lot worse if your immune system is suppressed. On top of this, there's a risk that existing infections could spread to the new organ, and you could be back where you started before surgery. Before being approved for a transplant, you'll need to undergo extensive testing, including blood work, urine tests, and infectious disease screening. Infections such as UTIs and pneumonia must be fully treated and resolved before a transplant can go ahead. More long-term infections such as HIV, hepatitis B, or hepatitis C were once considered a no-go for having a transplant. However, these days you can still be approved in certain cases, so long as the infection is stable and under control. It's vitally important if you're considering a kidney transplant to stay on top of your health by having regular checkups. If you're proactive, when the time finally comes for a transplant evaluation, infections won't stand in the way of your eligibility. Next up, at number 4, we have a reason that may surprise you: obesity. When applying for a kidney transplant, your weight plays a more important role than you might realize. Obesity, particularly severe obesity, complicates every step of the transplant process, from surgery to recovery. The risks associated with anesthesia increase dramatically with obesity, which can lead to complications during surgery. On top of this, it can be physically more difficult for surgeons to access the kidney area to perform the surgery itself. But the risks don't stop there. Studies have shown that obese patients face higher rates of infection, plus slower wound healing post-surgery. For example, research indicates that patients with a body mass index over 30 are at a greater risk for delayed graft function. This is when the new kidney takes longer than usual to start working properly. As well as this, obesity often leads to other health conditions that affect kidney health, such as diabetes and hypertension. Both of these are leading causes of kidney disease and create a challenging environment for a new kidney, which is why transplant teams may be reluctant to approve the transplant. Because of these risks, many transplant centers set strict BMI limits for candidates, and obese candidates may often be rejected. This highlights just how important your diet is when it comes to kidney health, which is why we'd like to thank you for watching with your 2 exclusive free gifts that will come in handy. Discover an entire world of kidney-boosting knowledge, tips, and tricks with the Kidney-Friendly Recipe Collection, containing more than 25 recipes for every meal, including dessert. Crafted especially for our viewers with kidney disease, this unique collection focuses on quick and easy recipes to whip up food that's both tasty and great for your kidneys. But that's not all. You'll also get access to the Alkaline Diet and pH Guide for Kidney Disease. This essential guide unravels the critical role of pH balance in kidney health. It includes easy-to-follow advice on testing your pH levels at home, plus practical diet tips to support kidney health. Get each of these powerful gifts for free. Just click the link in the description below and start using these life-changing strategies today. Okay, back to the video, and let's take a look at other reasons why you may not be able to have a transplant. At number 3 on our list, we have cardiac issues. Many people don't know that the heart and the kidneys are closely linked, and problems with one often leads to issues with the other. If you've recently suffered from a heart attack or have a severe cardiac condition, such as congestive heart failure, the risks involved with receiving a kidney transplant will be heightened massively. The stress that transplant surgery places on an already weakened heart can lead to serious complications. This is why transplant teams will often work with cardiologists to thoroughly assess your heart health before approving you for a transplant. This evaluation includes stress tests, ECGs, and echocardiograms to determine how well your heart is functioning. If these tests reveal significant heart issues, the transplant team might decide that the risks outweigh the benefits of the procedure. Surgery aside, a healthier heart can lead to a smoother recovery process. For example, good circulation is crucial for the healing process post-transplant. If you already have cardiovascular issues, your body may struggle to accommodate the new organ. Another reason why cardiac health is so important is because of the post-transplant medication. The meds used to prevent organ rejection can have cardiovascular side effects, which might worsen existing heart conditions or even trigger new ones. However, it's not all doom and gloom for people with cardiovascular issues. Just because you have poor heart health, it doesn't mean you'll automatically be disqualified. There are often things you can do to improve your chances, such as making heart-healthy lifestyle changes, or even undergoing procedures such as stenting or bypass surgery first. Next up, at number 2 on our list, it's your cancer history. Unfortunately, cancer can significantly affect your suitability for a transplant. The main concern is the risk of cancer recurrence. Transplant recipients have to take immunosuppressive drugs to stop organ rejection, which unfortunately also suppresses the body's ability to fight cancer. This means that patients who are in remission will not be eligible for a transplant. That being said, the type of cancer and the length of remission play critical roles in determining your eligibility. For example, cancers such as skin cancers that have a lower risk of spreading and can be fully removed might not disqualify you. However, more aggressive cancers, like those of the breast, lung, or colon, require a longer period of remission before a transplant can be considered. Patients are carefully assessed on a case-by-case basis to measure the improvement to your life expectancy from receiving the transplant versus the risk of you developing cancer again. Often, you'll be monitored for several months by teams of oncologists and transplant specialists before a final decision is made. And finally, at number 1, we have perhaps the most surprising reason on our list today, because it has nothing to do with your health. It's psychosocial factors. Now, what do we mean by that? Psychosocial factors include a range of personal and social aspects, and can involve things like your mental health and substance abuse issues. You see, when it comes to a transplant, it's not just about your physical health. Your lifestyle, mental health, and social support systems play key roles in determining if a transplant will be successful for you. For starters, your history of following medical advice is a huge factor. Many people aren't aware of this, but transplant teams will look closely at your history of following medical recommendations, including taking medications as prescribed and attending all necessary medical appointments, such as dialysis. So if you're someone who's currently on dialysis and would like to be considered for a transplant down the line, you'd better be sure to attend every appointment. But why does this matter? Well, post-transplant, you'll have to adhere to a strict regimen of anti-rejection medications and regular checkups. Failure to comply with these can lead to transplant failure. So, the transplant team wants to make sure that you're reliable before approving your transplant. Substance abuse is another significant psychosocial factor. Using substances like tobacco, alcohol, or illicit drugs can severely impact the function of a transplanted kidney and your overall health. If you have a history of substance abuse issues, you usually have to prove a period of abstinence plus engagement in treatment programs before you can be considered for a transplant list. Mental health also plays a critical role. Conditions such as depression or anxiety aren't automatic disqualifiers, but they need to be well managed. Untreated mental health issues can affect your ability to comply with medical regimens and impact your overall well-being. That's why psychological evaluations are a standard part of the transplant assessment process, to ensure you're mentally prepared and capable of handling the stresses of surgery and the post-operative period. Lastly, the presence of a solid support system is key. Transplant recovery can be challenging, and having friends, family, or community support can make a significant difference in recovery and long-term health outcomes. Social workers often assess the strength and availability of your support network when considering your eligibility. Healthcare teams will look at all of these factors to understand your lifestyle, environment, and personal habits. These assessments help to determine whether you're likely to follow medical advice and handle the responsibilities that come with receiving a new organ. So, if you hope to receive a transplant in the future, it's important to remember that your healthcare team is looking at the whole picture, not just your physical health. And that's why simple lifestyle changes, such as eating a kidney-friendly diet, can make a huge difference to your eligibility. And our free gifts can help you with that. Make sure to claim them in the description below. And did any of these reasons surprise you? Let us know in the comments. If you found this content helpful, make sure you drop the video a like and subscribe to our channel to stay up to speed with the latest kidney care news. Stay healthy, and we'll see you next time.